Okay, so I want to talk about preventing dementia. A lot of my patients will come to me wondering how they can prevent dementia. And the medical literature has found that about 40% of dementia cases are due to modifiable risk factors. There are 16 modifiable risk factors for dementia that I want to share with you in this video. I want to share with you some practices that I personally follow to address each of these 16 modifiable risk factors. So the first is hearing loss. You want to avoid exposure to loud noise. If you work in an occupation that exposes you to loud noise, you want to make sure you're wearing hearing protection. You want to make sure that you're avoiding loud concerts or wearing hearing protection to avoid exposure to loud sounds. Number 2 is vision loss. So you want to make sure you're getting regular eye exams and wearing eyeglasses if they're necessary. Number 3 is depression. So I find the best way of improving mood is social connection and physical activity. If you end up actually having depression, you can know if you have depression by going online, typing in PHQ-9. It's a validated instrument for assessing your mood. If you score a 10 or greater on this instrument, you have depression. If you have depression, therapy and medication are first line for treating it. The best therapy is cognitive behavioral therapy. The best medication is selective serotonin reuptake inhibitors. Lexapro and Zoloft are my 2 favorite to prescribe. Next is smoking. If you smoke, you need to stop smoking to prevent dementia and a whole host of other problems. The best way to quit smoking is with a cessation product. I'm talking about Chantix, Zyban, those are 2 medications, or the nicotine patch plus the gum combined. All 3 of those are first line for treating tobacco use. If none of those work for you, I do suggest you vape. Vaping, although it's vilified in the media, is a hell of a lot better than using tobacco. And if it's your only way of getting off tobacco, it is a far better option than continuing to smoke. Next is social isolation. So social isolation leads to dementia, and what I found is the best way to be socially connected is through doing things that I personally enjoy with others. For instance, skiing and climbing. Those are 2 activities I enjoy. Others around me enjoy them. Doing them together is an easy way of being in relationships and developing friendships with those in my community. Another way that people will find a social group is through volunteering. Volunteering is a great way of doing things with others when you share a common passion. Number 6 is heavy alcohol consumption. Heavy means anything more than 7 drinks per week, 7 servings per week. I've actually found that alcohol, even in moderation at that level, still makes me feel like crap and affects my sleep. So I've cut back to probably 1 drink every couple of weeks. But as long as you're not exceeding 7 drinks a week, you're okay. Next is air pollution. Where I live, I don't live in a city, I live in a rural area. The biggest risk for air pollution is from wildfire smoke. Ways I mitigate this risk are I run a HEPA air filter in my living space, and I wear an N95 mask if the air quality index ever exceeds over 100 in my area, or if I smell wildfire smoke. Physical inactivity. So physical inactivity is a contributor to dementia, and there are a few components to being physically active. You want to engage in at least 12,000 steps a day. That's number 1. That's often hard to do during a work week, but doing big hikes on the weekend can up your step count for the week. 2 20-minute strength training sessions per week. The way I accomplish this is through rock climbing and through yoga using the Down Dog app. You want to limit your total sitting time to not more than 8 hours per day, and you want to limit any episode of sitting to not more than 30 minutes. Traumatic brain injury contributes to risk for dementia. So if you're doing any kind of high velocity, high impact sport, you want to wear a helmet. That means, for me, wearing a helmet when I go mountain biking, wearing a helmet when I climb, and wearing a helmet when I ski. Inadequate sleep leads to dementia. So you want to ensure you're getting at least 7 hours of sleep each night. You want that sleep to be non-medicated, if at all possible. And you want to have a consistent bedtime each night. That will afford the best quality sleep. That means even on weekends, same bedtime. Obesity is a risk factor for dementia. You want to maintain a body mass index, BMI, and you can look that up using an online calculator where you input your height and your weight, of less than 25, or if you're Asian, less than 23. Biggest contributors to overweight and obesity that I see in my patients are snacking, eating in between meals, sweets, especially beverages that have added sweetener, and then finally refined grains. So I'm talking about white bread, white rice, pasta, and starchy vegetables like potatoes. Limiting those 3 food groups will help to prevent overweight and obesity. And I'm a big fan of the GLP-1 receptor agonists like Wegovy and Zepbound if your BMI remains elevated despite your attempts to change your diet. Number 12 is hypertension, a risk factor for dementia. You want to make sure your systolic blood pressure, that's the top number, remains under 130. You can get that checked in the doctor's office. You could buy a machine to check your blood pressure at home. They cost about $50. The most important ways of lowering blood pressure are increasing fruits and vegetables in your diet. I recommend 1 fruit a day and at least 4 servings of vegetables every day. That's about a cup of vegetables or 2 cups of salad. You want to also limit added salt. Added salt is most commonly found in processed food, in food you get at a restaurant, but also it comes in adding food when you're cooking and at the table. There's a product called New Salt that I recommend to all my patients with high blood pressure. It uses potassium chloride instead of sodium chloride. It tastes like salt, but it actually lowers blood pressure instead of raising it. If your systolic blood pressure remains 130 or above, despite these lifestyle recommendations, I do recommend getting on blood pressure medication. Talk to your doctor. Next is diabetes. Diabetes raises risk for dementia. You want to make sure your hemoglobin A1C, which is your average blood sugar over the past 3 months, remains below 5.7%. That's the threshold for prediabetes. 3 biggest contributors to elevated blood sugar are sweets. The 2 biggest contributors to elevated blood sugar are sweets, especially sweets that come in liquid form, like soda and even juice. Refined grains like bread, pasta, white rice. Starchy vegetables like potatoes. And I've actually found that higher blood sugars sometimes are caused by having too much fruit. I recommend, therefore, consuming only 1 serving of fruit each day. I don't eliminate fruit completely because it improves lifespan and has lots of antioxidants which fight inflammation. Next risk factor for dementia is a high LDL cholesterol. This is the bad cholesterol. Your cholesterol goal is either going to be under 100 or under 70, and that's determined by your 10-year risk of heart attack or stroke. Essentially, if your 10-year risk of heart attack or stroke is above 7.5%, your goal is going to be more aggressive. It's going to be less than 70. Everyone else, their goal is less than 100. If your LDL is not at goal, you want to focus on reducing the saturated fat from red meat and dairy. Pork is red meat, so it's beef, pork, lamb. You want to limit those foods. You want to limit full-fat dairy, that's whole milk, cream, butter, cheese, half and half, ice cream. You want to limit cholesterol from foods. So I'm talking about egg yolks and shellfish, shrimp, lobster, crab. I also recommend using a paper filter for your coffee. Coffee has a chemical called dipterines. Dipterines raise LDL cholesterol. If you use a paper filter as opposed to an espresso machine or a French press or a gold filter, if you use a paper filter, you remove the dipterines from coffee, and that reduces your LDL cholesterol. If you like espresso, you can actually buy filters that go in the bottom of the wand that you use to make the espresso. That, in effect, will filter out the dipterines while still allowing you to drink your espresso. Number 15 is vitamin D deficiency. If your vitamin D level on a blood test is less than 30, you want to supplement with vitamin D. 30, you want to supplement with vitamin D. You want to use vitamin D3, 5,000 international units once a day. And getting plenty of sunlight is a good way of preventing vitamin D deficiency. Although in some parts of the country, no matter how much sun you get, in the winter, you're not going to get enough sunlight to make an adequate amount of vitamin D, so you'll need to supplement. That's the case where I live in Lake Tahoe. And finally, you want to avoid medications that increase risk for dementia. The most important medications to avoid are benzodiazepines like Xanax, Ativan. Anticholinergic medications. These are like tricyclic antidepressants like amitriptyline. First generation antihistamines like Benadryl, hydroxyzine, and doxylamine. And proton pump inhibitors, PPIs like omeprazole, Prilosec. So these are medications that are not first line for treating conditions, so you should be able to get off of them. But I would talk to your doctor. Benzodiazepines are not first line for anxiety, so you should be able to talk to your doctor about alternatives. Tricyclic antidepressants are rarely first line for depression. SSRI, selective serotonin reuptake inhibitors, have better evidence, less side effects. First generation antihistamines like Benadryl, hydroxyzine, doxylamine aren't necessary for allergies. You can use second generation, which are non-sedating and don't have this risk. And using these medications for sleep impairs sleep quality. It's better to aim for natural sleep. And if you need a medication, not to use one of these CNS depressant medications. And finally, proton pump inhibitors. Proton pump inhibitors are rarely necessary unless you have Barrett's esophagus or a history of ulcers. There are a lot of ways to not need proton pump inhibitors if you have reflux. They include weight loss, avoiding triggers like spicy foods and heavy meals, and avoiding lying down within 3 hours of bedtime. So I've shared with you 16 risk factors for dementia and how you can do something about it. I hope you take these tips to heart and make these adjustments. Avoiding dementia is a worthy goal. Have a great day.